With Americans living longer, more vibrant lives, the notion of what is considered too old for sex is being challenged every single day. And here to address some of the unique challenges and opportunities that go along with seeking sexual fulfillment in later years is Dr. Gloria Davis. She's professor and chair of obstetrics and gynecology, the department at Meharry Medical College. Thanks for being here.
Thanks for having me, Amy.
And I'll tell you, it was hard to read through this because sex is not easy to sit on television and talk about.
It absolutely isn't. It's an uncomfortable topic for many people, and even, you know, outside of TV, in the office, in the physician's office.
But
it's an uncomfortable topic.
But it's such an integral part of everyone's life that you really do have to seriously get real. And if you have issues, especially today we're talking about senior women,
yes.
You know, you really have to sit down and open up and not be afraid to talk about it. So one of the first things we're going to talk about is the fact that, you know, there are a lot of women who are having issues with sex as far as pain goes.
Absolutely. You know, I kind of smiled as you said senior women, because we really are talking about women who are perimenopausal or menopausal, which can start in their 40s.
Exactly.
Where they begin to experience vaginal dryness, and further into menopause, where there is a loss of estrogen, then vaginal atrophy, where the mucosa really becomes thin and doesn't have the same vasculature. So those issues is really what causes the pain that most women experience, perimenopausal and menopausal.
Right. So what do you suggest that a woman does? She starts experiencing this, and I mean, just you've got to get to the doctor and just, you know, have a conversation?
Right. Some of it depends on whether or not that's the only symptom that she's having. Certainly there are other symptoms of menopause, like hot flushes, night sweats, that would be treated with systemic, with oral medication, versus if it really is just, you know, sexual discomfort, then a lot of that can be handled with over-the-counter type of preparations that are non-hormonal. We know that the Women's Health Initiative has made women very cautious in terms of using hormone therapy. So the non-hormonal approach, over-the-counter vaginal lubricants versus vaginal moisturizers may be an option. And I distinguish between the two because the vaginal moisturizer would remain in the vaginal mucosa a little bit longer and give you longer comfort, maybe 3 to 4 days, and as opposed to lubricants.
Well, and that's better than having to live with that pain, or having the pain that some women, you know, continue to occur within them. All right, so what about the decrease in libido? That's huge with women as you begin to age.
It is, and some of it has to do with the drop, obviously, in hormone therapy, not in hormones, not just estrogen, but androgens, testosterone. And women are always sort of surprised at the fact that, yes, we do have testosterone. And that's really what drives a lot of our interest in sex, even though women who undergo surgical menopause, where they've had their ovaries removed, those are really the women who have the greatest loss in libido. Where unfortunately, unlike men, we don't have an FDA-approved option for replacing that testosterone.
Right. Well, unfortunately, we don't have time for more. I know we could probably have taken 1 million calls today from folks with lots of questions, but thank you for being here.
Absolutely.
We really appreciate it. Get that conversation going with your doctor for sure. Contact your gynecologist or your family physician if you have any more questions. It's very important.